So here's a quick rundown on how the IVF process works. You always start any treatment that you have at a fertility specialist with your new patient appointment. And during that time, we talk about your medical history, your fertility history, and what the goals are for treatment. That's then followed by the next step, which is diagnostics. Those include tests including ultrasound, possibly a tubal assessment, and blood work that helps us to create a picture of how we're going to continue with treatment. After that, you have your follow-up with your doctor to discuss what was found and the plan for treatment thereafter. If IVF is the next step, you then will begin stimulation after a couple of weeks of birth control generally. That stimulation will go on for an average of 10 days where you're taking injectable hormones to get all of the eggs in the ovaries to grow. You then finally take a final shot to make those eggs mature, and 36 hours after that, you have your egg retrieval. That's done while you're asleep. A little needle is placed through the vaginal wall into the ovary and take out the eggs. The eggs are then fertilized, either by themselves, they do their own fertilization, or we do an ICSI where we inject the sperm into the eggs, and we watch the embryos grow for 5 or 6 days. At that point, they can either be frozen or biopsied to check to make sure genetics are normal. The patient then gets ready for their frozen embryo transfer process, which takes about 2 months. Their uterus is prepared using birth control and then estrogen to build the lining of the uterus, and finally progesterone to get it ready for the transfer. 9 days after the transfer, you then have your pregnancy test, and hopefully it's a positive.